Good afternoon, students. Today's topic is pathophysiology of fever or mechanism of fever. As you know, temperature regulation located in preoptic area of anterior hypothalamus. Fever is also known as pyrexia or febrile. Pyrexia is the Greek word pyre means fire and febrile is Latin word febris means fever. Fahrenheit Celsius conversion table 105 degree Fahrenheit is equal to 40.6 degree Celsius and 100 degree Fahrenheit is equal to 37.8 degree Celsius. 98 degree Fahrenheit is equal to 36.7 degree Celsius. A fever is a rises in body temperature. It's usually a sign of infection. The fever itself is generally harmless and probably helpful. Fevers usually do not need treatment. The average body temperature is 98.6 degree Fahrenheit or 37 degrees Celsius. But normal body temperature can range between 97 degree Fahrenheit and 99 degree Fahrenheit or more. Your body temperature can vary depending on how activity you are or the time of day. Generally, older people have lower body temperature than younger people have. The following thermometer regarding generally indicate a fever. Rectal, ear, temporal artery temperature of 100.4 degree Fahrenheit or higher. Oral temperature of 100 degree Fahrenheit or higher. Armpit temperature of 99 degree Fahrenheit or higher. Fever is an elevation of body temperature above normal circadian variation as a result of change in thermoregulatory center located in anterior hypothalamus. Most common presenting symptom to clinician may associated with other symptom, example chill, trigger, body ache, generalized weakness, headache, and anorexia. Fever relation with pulse, respiration, and BMI. With every 1 degree Fahrenheit rises of temperature more than 100 degree Fahrenheit, pulse rate increase by 10, respiratory rate by 4, and BMR by 7. Oxygen consumption increased by 13%. The effect of fever, metabolic effect, increase need of oxygen, increase heart rate, increase respiration, increased use of body protein as an energy source. During fever, body switch from using glucose, an excellent medium for bacterial growth, to metabolism based on protein and fat breakdown. Effect of fever: it enhances immune function, increase motility and activity of WBC, stimulates the interferon production and activation of T cell, inhibits growth of some microbial agents. Many microbial agents that cause infection and grow at normal body temperature. Stages of fever: four successive stages. Prodrome: non-specific complaints, mild headache, fatigue, general malaise, aches and pain. Number 2, temperature rises, generally shaking with chill and feeling being cold. Vasoconstriction: piloerection precedes onset of shivering. Skin is pale. Number 3, flush. Due to cutaneous vasodilation occurs and skin becomes warm and flushed. Number 4, initiation of sweating. Pathogenesis of fever: pyrogens, any substance that cause fever. Exogenous pyrogens, derived from outside the patient. Exo means outside. Microbial products, microbial toxin or whole microorganism. Mechanism of development of fever: when fever occurs, the thermoregulatory mechanism behaves as if they were adjusted to maintain body temperature at a higher than normal level. That is, as if the thermostat had been reset to a new point above 37 degrees Celsius. The temperature receptor then signal that the actual temperature is below the new set point and temperature rises mechanisms are activated. These produce chill sensation or even shivering due to cutaneous vasoconstriction. However, the nature of response depends on ambient temperature. The temperature rises due to increased heat production if in a cold environment, and 2, decrease heat loss if in a warm environment. Pathogenesis of fever: endotoxin from bacteria, inflammation, and other pyogenic stimulus. These act on monocyte, macrophage, Cooper cells to produce cytokinins and interleukin 1 polypeptide called endogenous pyrogens. They brain enters brain and direct effect on preoptic area of hypothalamus to cause increased synthesis of probably prostaglandin which produce fever. Aspirin by inhibiting synthesis of prostaglandin PGE2 and decrease the fever. Act on lymphocyte to activate the immune system. Stimulates bone marrow and cause neutrophil release. Proteolysis in muscle. Benefits of fever. Inhibit bacterial growth. Before the advent of antibiotics, fever was artificially induced for the treatment of neurosyphilis and proved to be beneficial. Hyperthermia benefit individuals infected with anthrax, pneumococcal pneumonia, leprosy, and various fungal rickettsia and viral diseases. Increase antibody production and decrease tumor growth. However, very high temperatures are harmful. When core temperature is more than 40 41 degrees Celsius or 106 degree Fahrenheit for prolonged period, it may cause permanently brain damage. When it is more than 43 degrees Celsius, death occurs due to heat stroke. Mutation of gene coding for ryanodine receptor leading to excess calcium release during muscle contraction. These increase heat production in muscles and cause marked rises in body temperature called malignant hyperthermia, a phenomenon commonly triggered by stress. Types of fever: continuous, intermittent, remnant, or relapsing. Continuous example: typhoid fever, typhus, drug fever, and malignant hyperthermia. Character does not remain. Intermittent fever: temperatures fall due to normally every day. Example: pyogenic infection, lymphoma, and military TB. Remnant: daily fluctuation more than 2 degrees Celsius. Temperature does not return to normal. Not characteristics for any particular disease. Relapsing fever: temperature returns to normal for day before rising again. Example: malaria, lymphoma, Hodgkin's lymphoma, and pyogenic infection. Fever with rigors: it is mainly present in malaria, Kala-Azar, UTI, septicemia, infective endocarditis, collection of pus in body, cholangitis, and pyelonephritis. Treatment: normal water sponge, tablet paracetamol, antibiotic, antiviral, and antifungal, and hydration. If bacterial infection, antibiotic is given, and if viral infection, antiviral is given. Thank you.